everyone, welcome back to another episode of Medicine in Minutes. I'm your host Swarna, and today I'm joined by Dr. Anna Menezes, who is a diagnostic radiology resident in University of Minnesota. Hi, Dr. Anna. Thank you so much for coming on the show.
Hi, thanks for having me.
Uh, just before we start, if you could give us and the viewers just a brief introduction about your journey from medical school into matching into residency.
Yeah, sure. So I did med school in St. John's in Bangalore. And then I did 2 years of rural service. It is not really compulsory if you graduate from St. John's, but you can volunteer to do it. And if you don't want to do it, you can sort of pay it off. And if you do rural service in St. John's, you sort of have a preference to go back to St. John's for residency. During my years of rural service is when I wrote the steps, and then after those 2 years, I spent over a year just like doing observerships. I didn't do a lot of observerships, I just did two. And then like just publishing my research, presenting my research, and then ultimately applying. So I think it was um, almost a year after the 2 years of rural service that I interviewed, and then I matched in 2024.
Oh, that sounds super cool. Congratulations again for
Thank,
matching.
thank you.
Um, yeah, so how did you decide on radiology? Was it something you walked into medicine thinking? Was it a journey? Like how was your process with that?
That's a great question. I feel like the first 4 years of medicine, I was always like, I'm gonna do internal medicine. Until like I became an intern, and I noticed that a lot of internal medicine is coordination, which is something like some people like it, but I personally didn't like it a lot. I feel like yeah, you spend maybe as like a medicine resident, you spend maybe like 30 to 40% of your day like actually discussing cases, discussing your plan, but then the rest of your day is like talking to nurses. And especially here in the US, it's like figuring out where the patient is to go, talking to nursing homes, figuring out placement, talking to social work. And I guess I'm a little introverted, and just like dealing with so many other aspects of medicine didn't really fulfill me. I felt like, I have all this knowledge and I can't just apply it. There's so many other like breaks before the patient can actually yield the fruits of whatever I studied. Um, and that really like changed my direction towards radiology. But I feel like the most impact it made was when I was doing these 2 years of rural service. I used to treat a lot of snake bites. And yeah, and like a lot of times I was like confused, like, is this so? A lot of patients actually don't know whether they've been bitten by a snake, especially in rural India, and especially with snakes like kraits who have really small bites. So it's like, is this a snake bite? Is this neck fash? Is this compartment syndrome? Is this a
Hmm.
kidney stone because they come with
Yeah.
abdominal pain? Like, and all those questions I couldn't have get any answers to because I was in the middle of nowhere. I didn't have access to a CT scan. And the moment you send a patient in a rural area to get a scan, it's like you're never gonna see them again because they're gonna pay like 2,000
Yeah.
bucks to get that scan done, and they're gonna be like, "This is too much. Let's just go back
Yes.
home and
They're just
like
gonna
deal
tap
with
out
it."
after that.
Exactly. So
Yeah.
I exactly. So I realized how impactful radiology is in medicine. Um, One in terms of how much of application you're doing, to like see the history of the patient, look at the images, look at what's been done so far, look at their labs, and then form a picture and then establish a differential. And also how much of a value radiology has in medicine. Like no patient that gets admitted to a hospital leaves without doing like
Yeah.
yeah, so you're like you're everywhere in the hospital, but at the same time you're not. So yeah, that's what made me choose radiology specifically over internal medicine.
Yeah, no, fair enough. I think a lot of people will resonate with that. It's a very I would say, underrated specialty in MBBS. I think you would probably second that. People don't realize how much, scanning sort of plays into actually diagnosing a disease at
Yeah,
the end of the day.
yeah,
And it's super cool that you probably feel very fulfilled in what you're doing
yeah,
right now. So how are you
yeah.
liking radiology? How is that for you?
So actually, in the US, when you match to radiology, your first year is called transitional year or prelim year,
Okay.
depending
Uh-huh.
on what you match into. So you actually don't do a lot of radiology.
Okay.
Unfortunately, you do a lot of it's like internship in India all over again.
Mm.
So we do 2 months of medicine, 2 months of emergency medicine, 2 months of surgery,
Oh,
1 month of
okay.
OB and 1 month of peds. So we do have 2 months of radiology, and those 2 months I feel like I was extremely happy and just like
Hmm.
so happy about like my journey. But the rest of it was great. Like doing
Yeah.
peds and internal medicine, OB-GYN was great. But at the same time, it's like, there's this thing of like, I just have to take in what's like what I'm gonna do for the next year. And a lot of it is
Mm.
like, it's like internship, it's like scut work.
Yeah,
So
fair
like,
enough.
yeah, you tend to feel a little like unfulfilled during like
Yeah.
transition year and prelim year, but I think it's a good like go through the fire so you can like experience what it is.
Yeah. Is doing these clinical months now sort of reaffirming your decision to do something
Oh,
less
yeah.
clinical? Yeah.
Yeah, we actually call this the year of confirmation, the year of
Oh, okay.
affirmation.
Fair enough.
Especially in my department, we're like, oh, you're going through the year of affirmation. Like, yeah, we all, like, every month we're like, oh, I'm so glad we don't have to do this again.
Fair enough. That's super cool though. Do you see now that you're somewhat more into radiology than you were when you were a medical officer, do you think it sort of lives up to the stereotypes that I'm sure you must have heard when you were telling people that you wanted to match into radio?
That, the clinically correlates stereotype.
Yeah.
I feel like it's a little different, especially
Okay.
it really depends on how you want to practice as an
Mm,
individual. You can be a radiologist who like just looks at the scans and says, yeah,
mhm,
these are my 6 differentials clinically correlate. But at the same time, I think a lot of us go into radiology not to be that person. We go into
mm,
radiology to be like, this is what I'm seeing, and looking at the patient's clinical picture, I think this is what's happening. Of course, you
yeah.
can't do that for everything. Like, some of my like professors that I look up to right now who are teaching me, like even they still took years and years to like figure out if a tumor is like a renal cell carcinoma or like
Mm,
a pheochromocytoma and stuff like that just on the image. Um, and some of my professors now can actually like differentiate histological types based on how it looks on how
wow.
a CT scan. Yeah.
That's cool. It's
Yeah.
like two in one.
Yeah, literally. And like, yeah,
Yeah.
exactly. So I feel like going, like, once you study, going back and seeing what happened to this patient, what their path report is,
Mm,
what was their clinical management at the end of the day, makes you a different radiologist. Like, you can be your
yeah.
classic stereotype, clinically correlate, but just putting that story together and, like, being able to, like, really feel what medicine is. Like sometimes when I do radiology, I'm like, am I like actually getting paid for this? Like this is the stuff of my dreams. Like it's like
Oh,
going through like, a diagnostic puzzle and like being
yeah.
like, okay, this is what's happening. I think it's this, I think it's that. It's like when you go to like these medical quizzes and you're like differentiating patients, like that's how I feel right now, but it's like real life and I'm getting
Oh,
paid for it. So it's like,
yeah.
wow.
It's like the dream job, basically.
Yeah.
No,
Yeah.
I'm like, I mean, then I can't wait for you to do more radiology then in the future.
I'm super excited, yeah.
Yeah.
And then
No.
I think the second stereotype is that AI is going to take over our job.
Yeah. Yeah.
To be completely honest with you, I don't think that's not gonna happen. AI is getting pretty good. I feel like there will be a point where AI can at least read like basic X-rays, basic CTs,
Hmm.
just like how AI reads EKGs now.
Yeah.
But if you give an EKG to a cardiologist and say this is what the computer read, they're not gonna look at it and be like, that's it.
Yeah.
They're always gonna be
Yeah.
like, so what's the patient's history?
Yeah.
Like they'll tell you what they think you can do, why the QT interval is so prolonged, or why it's short,
Yeah.
why the PR interval is like this, and that's exactly what's gonna happen in radiology as well. I feel like
Yeah.
the more AI takes over, like the basic stuff, we're gonna be pushed into either one, training AI and dealing with like supervising AI, looking at their reports, and to conveying that to a patient, making sure the patient understands it,
Yeah.
talking about like prognosis, talking about clinical prospects. So yeah, I feel like AI is going to play a big role in radiology, but I feel like depending on what kind of radiologist you are, your job is either going to get replaced or it's going to get way better.
That I think that's a really good answer. It's a matter of working with AI as opposed to sort of resisting change, because like you said, change is inevitable in every field, not just radiology. I think, the advancements of AI in every single clinical and paraclinical specialty is really something that it's a force to be reckoned with,
Yeah,
for
exactly.
sure.
Yeah.
Yeah. Yeah, so coming more towards your Emily journey, I know you said that you decided to, you know, sort of dedicate yourself to the Emily pathway during your medical officer days. So how did you decide on uh going to the US? Did you ever think of doing your residency in any other country, whether that's India or the UK or Australia or any other country? What sort of solidified that decision for you?
I think that comes back to my previous answer. I have three main reasons for this. But the first biggest one was US is the hub of tech. It's the
Mm,
place where everyone gets the newest gadgets. You're playing with the newest like toys in medicine, the newest scans. I remember when I was here for my observership, the butterfly was the big thing. And the butterfly is a portable ultrasound that you can just plug into your iPad and
yeah.
scan anyone. And I remember like I was a medical officer at this time and I'm like, if only I had this in my like center
In
in
the
the middle of
yeah.
nowhere. Yeah, it would have like made such a huge difference to
Yeah.
patients' lives.
Yeah.
Um, and not just that, like even in the world of AI, yes, India is definitely like one of the biggest players in tech.
Mhm.
But things roll out in the US first. Like India's
Yeah.
brains, they roll out in the US first. So I
Yeah.
wanted to be the resident that gets to train with not just like AI, but with the newest tech, with the newest gadgets, the newest machines, the like more quality machines. I feel like in India, a lot of residencies like they don't have an MR scanner.
Mm.
Sometimes like you don't get to do MRs till you're in third or fourth year because just the volume of MR is so low. So yeah, I wanted to be able to get like the whole spectrum of tech. The second reason is how protected residents are. Um, India is great for residency in a way that you're exposed to such a huge patient population. You have so much of like knowledge that's like firsthand. You're actually practicing it, but I feel like they have scores of like I don't want to. I love India. I love my country, but they don't treat their residents well. And I'm gonna be honest and say it because some of like my friends who've gone through residency in like government colleges, like I remember like one of them hadn't showered for 4 days because he was
Oh.
like in the ward, sleeping in the ward.
Hmm.
And these are the best brains of their country. These are the people that
Yeah.
are gonna make like these are the people that are gonna be my parents' future doctors. My like and I wouldn't want these people to like suffer just
Yeah.
to be great at their job. And like so many like young kids, like MBBS kids, they're like, I want to go to Ames, I want to go to like PGI, but like, what's the point of going there and being treated so badly for 3 years of your
Yeah,
life that,
exactly. Yeah.
like people are committing suicide? Not that the rate of suicides in the US is like, especially in physicians, is not very vastly different, but it's like these are the biggest brains in your country, so I feel like we're not doing due diligence to them and treating them well. So
No, for
yeah,
sure. Yeah.
yeah. I think this is also a PSA for like residency programs in India to treat their residents well. But
Yeah.
yeah, the contrast here, it's so insane, Swarna. Like my
Uh-huh.
program director checks on me like I had like a harder rotation and he texts me, he's like, hey, how are you doing? Are you doing okay?
Oh.
My program, like radiology program director, she checks on me, even though like I'm not actually fully plugged into radiology right now. Like people give us gifts, people appreciate us. Like we have call rooms and each call room is locked and we can work in our call room at night. And then sometimes like I have to leave the hospital really late at night and I live in downtown, so it's kind of scary, but people walk
Mhm.
me home. Like we have,
Oh,
yeah, we have
proper
cabs to take
support
us home.
systems.
Exactly. So the
Yeah.
support is huge.
Yeah.
And I feel like I used to keep telling my mom this. If you give me that residency program in India, I would, like, hands down, I would stay in India. I would stay in Bangalore because I
Yeah.
love Bangalore.
Yeah.
And like, I didn't come to the US for like money or like fame or like,
Mm.
you know, I just came here because I wanted to feel supported as a human. I feel like I won't be able to make my brain work and I won't be able to be a great doctor. Even if you're
Yeah.
flooding me with like 1,000 cases of like the most insane things that I've never seen, but if you're yelling at me and my seniors are asking me to call them sir and like
Uh,
all of that stuff that goes on,
mhm.
then I wouldn't flourish as a doctor, and that's I think my biggest reason. Yeah, I hope I don't trigger people with that response.
No, I think it makes a lot of sense, honestly. Like it's not just the support system that you get there, but the way you learn, everything seems to just be different. And I guess for some people it works here, some people it works there, but yeah,
Yeah,
it's nice that through your supervisors you don't just get a boss, you get uh like a helping hand, you get a mentor at the end of the day. And I think, like you said, that really does matter when you're thinking about the fact that these are all the people who are going to treat the current doctors today at so they're just treating
yeah,
you the way they would want to be treated, which I think is very special. Yeah,
exactly. Yeah. I
yeah.
feel like,
So,
especially if you're treated badly,
hmm
as a human, you're gonna take that out on the work that you're doing. And I just feel like, yeah, we have to treat, like, as Indians, we have to treat our doctors well. We really, really
yeah,
have to. Yeah.
yeah. I guess that's something we can learn from the West, maybe the way
Yeah.
that culture. I think it's slowly, I guess, I hope it is coming into sort of our system as well, but step by step, I'm
Yeah.
sure
Yeah.
it'll soon get inculcated.
Yeah, for
So,
sure. I think
yeah.
yeah, sorry, we can go to the next question.
No, no, please do continue. Yeah.
Yeah, I think like a lot of like at least private medical schools are sort of having a lot of wellness. I do
hmm
see it happening slowly, but yeah, I
Yeah.
hope like it goes into other realms as well.
Yeah. No, I hope so. But step by step, one day.
Yeah, step by step.
Hopefully the
Yeah,
India that you come back to will be,
yeah,
flourishing in
yeah,
that sense.
yeah.
So it's interesting to get your perspective on that because, like you mentioned, you have a lot of experience working as a doctor post-internship in India as well. So, how was your experience as a rural doctor? Were there any cool cases that you saw? Was there any jarring moments that you had sort of sitting in those OPDs?
Yeah, I think those were at least until I start radiology. It's definitely been the best 2 years of my life. I was the only doctor in that that center, and I wasn't even
Oh,
a
wow.
doctor. Like I was like post internship.
Yeah.
And it was like me and three nurses and a cook, and like
Oh,
a
wow.
clinic. We all used to live in the hospital. Lived on the top floor, and the bottom floor is where like the patients would come. We had an OPD and we had an emergency, and as I said, like it used to be majorly snake bites.
Mhm.
Um, I did see a lot of cool cases. I saw tuberous sclerosis,
Oh, wow.
neurofibromatosis.
Mhm.
Yeah, I saw a lot of like, especially in rural areas, there's a lot of like consanguinity. So you see a lot of like rare chromosomal diseases.
Mhm.
And then, yeah, there were like things that I remember there was like this one girl who came in with like ankle swelling, and her family's
Mhm.
like, oh, she's just like making it up. Like every day she wakes up and there's like pain in different parts of her body. And I'm like, oh, I'm so sorry. And it's like hard not to like get sidelined when like the family's telling you this because they've obviously seen the patient more than you have.
Mhm.
And like one of the nurses who was working there, who was like living in the hospital, goes, "Oh, I actually had like a very similar kind of picture, and it turned out to be rheumatic fever." And I'm like, "Oh,
Wow.
okay, so yeah, so like we the only like inflammatory marker we have there is ESR." And the way we do it is like literally like take the whole Westergren's tube and like wait for
Oh, so it's like physio lab all over again.
literally, so we did the whole tube and waited for it.
Yeah.
ESR was super high. It was like off the charts. Like
Oh,
it
wow.
wasn't even like sedimenting. Um, and I sent her to John's. I remember I gave her a letter like this could
Mhm.
be rheumatic fever. And guess what? Turns out she had rheumatic fever.
Oh, she had rheumatic fever.
Yeah, her ASLO was positive, and
Uh-huh.
um, I got a call like from the brother of like the family because they didn't even have phones, and they were like, yeah, it was rheumatic fever. She was in the hospital for I think 4 days, and yeah, they
Oh,
gave her like
wow.
penicillin, and she came back and she's fine. So yeah, those
That's,
are the
yeah.
yeah, those are the cool things you see working as an RMO. So if anyone's deciding to do it, go for it. It's such a nice time, and yeah.
Um, yeah. That was my next question. Would you advise people, especially who want to go abroad, to sort of have those foundation years in a rural setting or even in a small clinic in India before they sort of go about their residency programs abroad? Do you think that really changes your outlook on things?
I feel like it depends on what stage of your
Hmm.
USMLE prep you are in. If you're someone who has already written the steps in medical school, already have observerships lined up, and you want to match right after medical school, then like I would say don't do rural service because you already have this
Hmm.
plan. And but at my stage I was like confused at that point. I was like, do I really want to do MLE? Do I like
Yeah.
I know I had a video with these other people when I was actually a rural officer, and I've literally said like I was searching for my purpose in life, which was literally what I was doing at that
Yeah.
time.
Hmm.
And I feel like it played a huge role in me deciding to do radiology, deciding to come to the US. So yeah, I would encourage someone who's like confused and at least as a doctor and doesn't know what they want to do, definitely do rural service. It's really beneficial to the country. You get to see like another side of medicine. Um, but if you already have your path laid out in front of you, you already know when you want to match, you already have your steps, everything done, then like go ahead and
Go
do
ahead.
what's
Yeah.
set up for you.
Makes
Yeah.
sense.
Yeah.
Yeah. How did you juggle sort of your step prep and your research and all of that with your clinical duties? Because as you said, you started while doing your rural work, but you were also the only doctor in, the place that you were working at. So how were you able to sort of juggle those two things?
That's a great question, and I feel like that's something that a lot of like interns struggle with as well because they're like
Hmm.
studying for the steps
Yeah.
as well. Um, I would say have a study partner. I had a study partner in the U.S. So in the morning, I
Okay.
would wake up at 6, and that would be like her like 7:30 p.m. or whatever. And we would
Mm-hmm.
study together for 3 hours before my clinic started. And then in clinic, especially if you're like working in a rural service setting, it's not that you're constantly busy like a city OPD. You do get some like downtime, like when people go get labs or you send people outside, you do get some downtime. So I used to just like revise at that time. I wouldn't do like new questions or anything. So the morning would be questions, the clinic time would be revision, and then we'd get a break um, between. Oh, sorry. Can you still hear me?
It's okay. Yeah, yeah, I can still hear you.
Sometimes when I like hit my earphones, it just like does some crazy thing.
I have the same issue. It's okay. No, I can still hear
Yes,
you though, don't worry.
awesome. So
Yeah.
12 to 4 would be break, and then I would do new questions then. And then 4 to 8 would again be like OPD emergency, revise then, and then every alternate day would be a different thing at night. So some nights I would do research, some nights I would do like studying for the OET, some nights I would take a break, and then some nights I would like revise an NBME. So that part of my day was like a little like alternative, but the morning and afternoon were
Hmm.
more scheduled. And I'd have different study partners for like the morning, the afternoon, and the night. So yeah, so like there was never a time where I didn't like because other people were studying with me.
Yeah. So it's like
Yeah,
you could hold each other accountable.
yeah,
That's
yeah. And
yeah.
like the people I studied with are now like here in the US, like matching and
Oh,
stuff. So yeah, one of
oh,
them is
that's so
like just
sweet.
starting residency this week. So like,
Oh,
yeah.
that's so sweet. It must be so
Yeah, one
nice
of
to
them,
see.
yeah, one of them like matched into Harvard for ortho.
Oh, wow.
Yeah,
Wow, a
yeah.
real go-getter then, I'm sure.
Yeah. So like when you're studying with these kind of people, it's like you're
Yeah.
forcing yourself, like yeah, yeah,
Yeah. No, that makes a lot of sense to have somebody to sort of you both have a common end goal and you can sort of see each other through it and push each other through it. I think that really does. I mean, I would say make or break, how you
yeah,
go about your journey to have those, again, support systems be there for you throughout whatever
yeah,
you're doing.
exactly.
So you mentioned research when you were doing, your rural work. What kind of research did you do in your undergrad or post-internship? And what kind of research would you advise IMGs to do if they want to match into, say, for example, radiology?
That's a great question. Most of my research was actually focused on low resource like medicine. My
Hmm.
first research project was using methylene blue to like diagnose UTIs over like a whole culture. Yeah, and that was my first research. My second one was during COVID, and it was like utilizing like COVID X-ray scores instead of CT scores and looking at patient prognosis. And I feel like most of my research like really ties up well. I did another research in my rural center about managing hypertensive urgency, um, like in a rural setting. So most of my research was like, how do I practice this in a low resource setting, or how do I make this work in a low resource setting? And I think that really tied up to my story because that's something I'm really interested in.
Yeah,
And when I came to the US, it was something that a lot of people asked me about, like, oh, why
yeah,
did you think of this? And I had a story, I had a reason, because all of my research was literally in the same like realm of things. So yeah, that was most of my research.
that's cool. It's like having a purpose instead of just doing it for the sake of your
Publication.
application.
Yeah.
Yeah, I'm sure that made a big difference.
It did, yeah, it really did.
Yeah.
Like, especially like here, a lot of people like ask you about things you do, and like they're really genuinely happy when like you're doing things that's just not for publication.
Yeah, that makes a lot of sense. Uh, how would you advise people who aren't sure how to go about research, who may not have sort of that structure in their college, or maybe, are doing rural service and don't know how to go about starting a research project? How would you advise them to go about that?
I would say don't stop and don't tell yourself that I don't have this, so I can't do this. Um, I am blessed in a way that St. John's has a great research institute, but at the same time, a lot of it is self-driven. Like, even if you don't have great research in your institute, you'll have great cases. I mean, it's India. Like, you have the best cases in the world. Like, just Google case reports, and the first thing you see, the first like free, PubMed journal, send your case report to them. And the moment you start doing that, you know how to write a case report, you know how publication works, you know how reviews work, you know how manuscripts work. And then your next step is like getting Zotero, getting Mendeley, knowing how to put citations in your like Microsoft document. And like a lot of this is self-driven. Like people think without a mentor I can't do it, without like my college having an IERB I can't do it, or without my college having like a research thing I can't do it, but actually you can. It's like it's super easy to just Google how to
Yeah.
use Zotero or how to use Mendeley, and like within an hour you're like putting citations in your project, and like it's so easy to write a case report. Like now with so many large language models, like you like a case report, if you have a case reports take like a max of 4 or 5 hours, like not even a day. So it's just that. And then once you write a case report, then you can write reviews of literature, then you can like review other research. So like start somewhere.
Yeah.
And I feel like telling yourself that you can't do it is the first like bad step. If you tell yourself I can do it, I'm just gonna try, like I don't care, I'm just gonna wing this, like I'll just do
Yeah.
something, and then it works out, and then research gets to you, and like you're publishing a lot.
Yeah, makes sense. It's like it's a matter of sort of gaining those skills along the way, even if it's
Yeah,
not handed to you. Like you said, everyone can somewhat find their way and figure it out, regardless of what, opportunities they have. Yeah,
exactly.
yeah. And in terms of extracurriculars, what role do you think that played when you matched? Do you think you had any extracurriculars that helped you stand out? Was that something that people looked at when you were applying?
I'm not like a sports person. I do play the violin.
Oh,
But
nice.
yeah, I remember when I was interviewing, I had like my violin at the back, and it was like kind of lit
Oh.
up. So it would be a topic of conversation. It did play a big role in one of the places that I really wanted to get in. Super impressed because his son also played the violin, and he was
Oh.
like, my son also plays the violin, and I know how hard it is, and I wish like you should come and like form a band and like in the
Oh.
program and stuff. Yeah, yeah. They were like, he actually like gave me like a soft rank to match, like saying that we'd love to have you in the program. So yeah, it does play a role, but it's almost like a hit or miss thing. Like you don't know
Mm,
what could strike a conversation and what couldn't.
yeah.
Um, and I feel like the worst thing someone can do is forcing themselves to have extracurriculars because it looks good on an
Yeah.
application.
Yeah.
Like if you genuinely like something, like I really like music. I go to like almost every concert here in Minneapolis. So like
Oh.
you can always like talk for hours about it, but if you don't like
Yeah.
something, it's really hard to make a
Yeah.
story out of it and talk about it.
Yeah. That makes sense. It's just a matter of being very true to yourself, regardless of what
Yeah,
you're doing, whether it's extracurrics, research, anything.
exactly. Yeah,
Yeah.
I love that. I like how you like put it together and said, yeah, it's
Yeah.
literally about being honest to yourself. Yeah, I love that.
Yeah. And when it comes to sort of reaching out to people who have matched or networking with other residents, how would you advise people to go about that? How do you advise people to sort of make those connections and get guidance from uh, other matched residents?
That's a great question too, and I think that also is like just being true to yourself.
Fair
Um,
enough.
But this is something I really wanted to talk about because
Hmm.
now that I'm on the other side, a lot of people reach out to me, and I do notice a huge difference between people that genuinely want help and people who are just like pulling at strings.
Hmm.
Like when you look at a person and you're trying to get something out of them, have your question in mind. Like if you ask someone, I just want guidance, I just want to like, I just want tips. Like there are like, in my journey, there are like 3,000 tips and 3,000 moments of guidance that I can give someone.
Yeah.
But if you have like, I remember when I just started my like channel, there was this guy who was applying to the match who texted me, and he had like, it was so nice. Like he was like, so I have these many publications and I know the average number of publications to match is this much. What do you think of that? Do you think I need to hit the average? Do you think that's important? What was your taking of that? Or exactly like you're asking me, Swarna, like you have these set of questions, like you're trying to get like this certain answer from me. You're just not asking me like what was like give me guidance. Like, it's like
Yeah.
throwing yourself out there. So like have your question
Yeah.
in mind. People in medicine and especially IMGs, they love to help. They will do anything to help someone else. It's not like I've never seen an IMG who's like, oh, I don't want to help you. Unless like, you're like competing with them for like a fellowship spot or like something like
Yeah.
that. Most IMGs love to help other people. They love to talk about their story. They love to talk about matching. But when you approach them with a specific set of questions. When you're here for an
Hmm.
observership and you're talking to a resident, maybe the resident's really good at research. So you ask them, hey, how did you start learning Python? How did you join this group? Like, Google them, see where they did their like stuff, see where they're doing their research, where they're publishing it, and ask them specific questions. Sometimes residents like may not have some great like they may not have done research in some great place. They might just be a nice person to talk to. I remember when I came here and one of my senior residents, he had 5 kids, and I was just
Wow.
like, how do you manage having 5 kids in residency? That was my question. And like
Yeah.
obviously, like they love talking about how they manage their kids, like how they have to wake up and send 5 kids to daycare, like, and that's how you form a connection. Like that's how people remember you, and that's
Yeah.
how people like vouch for you. Um, if you're gonna do an observership and just look at everyone and be like, oh, give me tips, give me guidance, like I'm just
Yeah.
gonna be like, you're like the 100th person that's walking and you're like asking for the
Oh.
same thing. So yeah,
Yeah.
be very, very specific in what you want
Okay.
because people would love to help you. It's just that you have to give them strings to pull.
Something
You
to,
shouldn't.
yeah.
Yeah.
Yeah. That makes sense. That makes a lot of sense, actually. And I'm sure that'll help a lot of people from India who don't know how to go about, doing that in the West, because it's obviously different. The way people approach things, the way you talk to your seniors itself is so fundamentally different here and there. So, yeah, I'm sure that'll help a lot of people who,
Yeah. Yeah.
are struggling with that now.
Yeah, yeah,
But,
yeah, for sure.
and when it comes to more competitive specialties, what do you think actually matters when you're matching into a competitive specialty?
I feel like most competitive specialties, the community is very tight knit. It's very small. So I think the easy part of competitive specialties is that it's easy to make an impression because the community is so tight knit. So I would compare this to like classic IMFM. I feel like in IMFM, it's like you have to get this has to be your score. This has to be your number of publications. You have to have like 3 months of USCE. Um, and that's how you match because a lot of programs just have filters because there are scores and scores of people applying. They have filters to just rule out people who haven't done this much USC, who aren't hitting their target scores. For
Mm.
competitive specialties, yes, you need to have like a good score. You need to hit like the basic numbers, like above 250, I would say for step two. But I do know people who match with like 240s as well, so it's not a hard and fast thing. You should have some sort of like clinical experience. But I think the most important thing for matching into a competitive specialty is making people know you and know your story. And a lot of people think that this is, oh, my alumni was here, my uncle was here, this is how I made the connection, this is my dad's friend, he's a program director. That's like, it does work for people who have that, but I never had that. I had one alumni who was doing radiology here. He had actually come through the ABR pathway, and he gave me,
Okay.
like, through him, I was able to get one observership. And that was the place I was telling you about with the program director whose son like plays the violin.
Uh-huh.
So that worked out. But I actually didn't have anyone at the University of Minnesota in the radiology department.
Uh-huh.
I literally started from scratch, started talking to residents, started talking to faculty, started talking to the program director, and like people
Yeah.
should know you and know that you're a genuine person who loves what they do, who loves like research, who is hardworking.
Yeah.
Like Swarna, if you put yourself in a spot of an American's like seat, and
Uh-huh.
someone like I come to you and like Swarna, can you give me a seat? And you don't know me, you don't know if I cheated on my exam and got my scores. You
Yeah.
don't know like you don't know if I genuinely like I'm a smart person. You don't know if I can speak in English. Do you really think
Mm-hmm.
you'll give me an interview?
Exactly. Yeah. I think
Yeah,
that's
yeah,
that's a facade, I guess, that
yeah,
it's a multifaceted thing,
yeah,
matching into this thing. Like you said, step scores is one thing. The number of hours you have, the number of publications you have is another thing, but it's a culmination of
yeah,
everything put together that really does
yeah.
help.
Yeah, and I feel
Yeah.
like it's really wrong to term this as connections and just give
Hmm.
it off like, oh yeah, she matched because she had connections. Like, those connections didn't just pop out of nowhere. Like, you
Yeah.
worked to get those connections. Like,
Yeah.
and that's the
Yeah.
biggest thing about, like, at least in like specialties like radiology, ophthalmology, anesthesia, dermatology, surgery, it's like you have to get your foot in the system, start talking to people, and make sure people know how hard you work. And yeah, that can be established through an observership. Like me, I just did two observerships. But that can also be established through a whole research year. Like do a research fellowship. Make sure
Mhm.
the program director knows you. Make sure other people know you. So yeah.
Yeah. Was that ever on your mind to do a research fellowship? Or
Yeah.
yeah.
So there are multiple reasons why I decided against it. One of
Hmm.
the biggest things was I had already spent a 2 years doing rural service. Um, I had a good enough score that I felt like I could match with. But I think the biggest reason was most research spots are unpaid and aren't J1.
Hmm.
I did not feel comfortable like asking my parents for money at like being like 27, 28, and like
Yeah.
and it's not easy to live in the US
Yeah.
as a research scholar with like not being paid. It's like at least like $1,200 a month that you'll have to take a loan for, like unless you're like really
Yeah.
rich. And I didn't want to do that at that stage. And then the other reason is most research spots are on a J1 visa. And I did not want to touch the J1 visa. I just do
Mm.
not like that visa. I know a lot of people are on the visa for good reason because in IM, like a lot of fellowships are purely J1. So even if you get an H1B like residency thing, there's a very low chance that you'll get an H1B fellowship spot. So you might as well start with a J1 and end with a J1. But on the
Yeah.
J1 visa, every time you leave the country, you need to get stamped to come back. That
Okay.
means you need an interview, you need to go to the embassy. Like, so
Oh
imagine you're going
God.
back to India for like 14 days, and 3 of those days are getting your stamp to come back. Um,
Hmm.
so that was one. And then the second thing is the J1 visa, once you're done with residency, you need to spend 3 years in the US or 2 years in your home country to transfer to any other type of visa. So
Okay.
if you matched into a J1 program and you had really great publications in your like second year of residency, and you're fit to like apply to the green card on an EB1, you still can't do that unless you finish your residency
Oh,
and
okay.
finish these 3 years.
Oh, wow.
So
Okay.
radiology residency is 6 years,
6, yeah.
and these 5 years, sorry, and these 3 years would be
Mm.
8 years, and doing a
Oh, wow.
research year would be another year. So that means I come to the US, and I'm stuck on the J1 visa for 10 whole
10
years before
years.
I
Yeah.
can like be a citizen or like get a green card. And
Yeah. Before you can
um,
peacefully go back home.
yeah,
Yeah.
exactly. You can't even peacefully
Okay.
go back home. You have to like
Yeah.
get stamped and everything.
Yeah.
But yeah, it works for some people. It works for a lot of people in IM because their residency is 3 years, their fellowship is 3 years. And
Hmm.
they can like get it over with. And there's a lot of like J1 waiver spots for IM doctors as well. There are a lot of J1 waiver spots for radiology as well. But it works for
Hmm.
some people, it doesn't work for some people. My
Yeah.
personal
Makes sense.
preference was that I did not. And like looking at the current scenario about like the whole like bans and everything,
Yeah, it's probably
I'm
a good
like, oh
choice.
God, thank you that I'm not on this J1 visa, you know. But yeah, you never know what can happen.
Yeah.
Like it could happen with the H1B as well. Um, like
Yeah.
especially when you're not a citizen of a country, like you don't know what can go wrong with your visa. But I would just prefer to like have a little more safer visa and a little more
Yeah.
direct pathway to like my future.
That makes sense. And I'm glad that that worked out for you,
Yeah.
really well.
Yeah, it really did.
Yeah. So looking back at your journey, is there anything that you wish you had done differently?
Um, Not really. I feel like everything just fell into place. Yes.
Okay.
I would say maybe one thing. I got really stressed about step two. And
Okay.
in my head, I wanted a 270 score. Like since the time I started preparing, I'm like, I want 270, I want 270, I want 270. And I was supposed to give step two in India. And like the week before, I did like NPME 14 and I got 257. And I'm like,
Mhm.
I literally like had a mental breakdown. Like I
Oh,
won't be able to match with this score. Like and then I postponed my exam. I wrote the exam in the US. And yeah, I ended up getting scores in 270s, but did it actually play a big role in my matching? I don't think so. I feel like at
okay.
the point that I had my score, there were a lot of like, there were programs telling me that they would match me. So
With
like, I don't,
yeah.
yeah, regardless of my score, like, um,
Yeah,
yeah, like I remember like in one of my observerships, I told like the program director, I'm still preparing for step two. I don't know how that's going to turn out. And they were like, yeah, that's totally understandable. Just let us know how it goes. Like if it goes badly too, like we understand, like things happen. And yeah, maybe that if it had gone really badly and I'd got like 230s or something, maybe that would have been a huge red flag for me. But I feel like if you're getting 250s or 260s, like don't beat yourself up about it. Like concentrate on your life and just be happy.
yeah. That makes a
Yeah.
lot of sense. Yeah.
Yeah, yeah. I feel
Yeah.
like you don't have to hit 270. And sometimes I feel like my 270 score was a red flag more than a good thing because
Oh,
when people
okay.
saw 275, they were like, did you cheat? Like,
Mm,
especially because the whole thing
Nepal.
happened. Nepal thing
Yeah.
happened.
Yeah,
And it
yeah.
was the same time. So
Oh, okay.
so
Oh no.
yeah, so it was like everyone saw the score and they're like, "How did she get that score?"
Mm,
But
it's
yeah,
like a double-edged.
exactly, especially if programs don't know you. Like my program
Hmm.
director, she'd met me. She like knew that I'm like a kind of smart person, like, and
Yeah.
I can answer
Yeah.
questions. So like when she saw the score, I guess like she wasn't like surprised. And I
Oh
already
God.
told people in the residency that I'm targeting 270 and this is what I want. But like
Okay.
if some random person like sees my score and like says, "Oh, this is this random person who like is doing rural service in the middle of nowhere, like how is she getting 275?" Like,
Yeah, there are like alarm bells that I'm sure that start
yeah,
ringing. Yeah.
exactly. So yeah, I'd
Uh,
say like a 250, 260 score is great. You don't have to beat
is
yourself
okay.
up to like get
Yeah.
some great score. Yeah.
Yeah. Do you think the fact that the passing score for step two has increased now, do you think that'll affect uh Anything do you think that'll
Um,
affect the way people view the exam or the way program directors view your scores? No,
I
okay.
don't think so. Especially like now, like looking at things from the other side of it. This is not for medicine or FM or peds or like the IMG friendly specialties, but more on like the competitive specialties. I don't think scores have a lot to do with you matching apart from you like passing the
Okay.
filter. Like if you get a
Yeah.
250, you kind of pass the filter and like
Yeah.
most of your matching comes from like the program leadership knowing you and knowing you as a person. So yeah, I don't think like prospects are going to change if you're applying to a competitive specialty. Um, they might change. I don't know. Like I feel like it's bad for me to talk about IM because I don't know like how the matching
Okay.
landscape is. But it
Okay.
might
Okay.
change in that, like especially in IMG friendly, like where a program is like
Mm.
50% IMGs, like maybe scores would play a big role in that.
Fair enough. That makes a lot of sense. And how do you think people from India should go about getting rotations? I know you said that you got one of your observerships uh, through somebody that you were aware of, but it was still a contact that you had built on and you worked towards. How would you say people should go about that?
I only got two observerships, so I don't know if I'm the right
Still, I
person.
mean, it's two is better than nothing. So,
One, look at programs that have formal observership programs. I feel like a
okay.
lot of programs actually have formal observerships that are free,
Okay.
that are just like hidden in their website, and like you can't just really see it. So like if you just type um, this university observership a program, see if they have a formal observership program, and reach out to program coordinators and not program directors and attendings. Because program
Okay.
directors and attendings, they're so busy, they're not going to look at their emails, and there's a high
Yeah.
chance that your email's getting like blocked out and marked as
Lost.
spam because it's from a different
Okay.
country and not from the institution. But program coordinators and coordinators, like in general of the program, their duty is to read their emails, so they will like mostly reply to you even if they don't give you a great response. You might get a generic response saying, hey, we don't have this observership program right now, but it's a response is a response, like at least you
Yeah.
have that confirmation that you can't do an observership. And
Mm-hmm.
then my biggest advice is like divide the whole of US into places you want to go, places you feel like you can go, and places you like reach places, and places that are like backup.
Okay.
So you have to have like your reach places, the places where you think you can go, and the places as a backup. Your reach places can be like Harvard, Beth Israel, and like Stanford, all of that. Places you think you can go are places where you have connections, where you've done observerships, where like your alumni are training, where someone in your med school is training as a resident, where you feel like you can go to the program and make a connection. That's places where you think like you have a good chance of matching. And then your backup places are places that are extremely IMG friendly, that will give you an interview even if you don't really know them well. So those would be
Okay.
your backup places. Your target should be these places where you can match. So suppose you want to go to Pennsylvania. Look at every program in Pennsylvania and see which one has an observership program, which program has IMGs. Make an
Mm-hmm.
Excel sheet. This program has this IMG, and like sometimes it's really hard because like they might be US IMGs, they might be like you
Yeah.
won't really know like just through the list. Like
Yeah. Yeah.
yeah, like they won't have their med schools, like stuff like that. So at least try to like gauge. And Frida, like AMA has the like uh, their own software that helps you like see how many IMGs match, how many
Okay.
IMGs matched last year, how many IMGs matched this year, what's the
That's
trend of
yeah.
them matching IMGs. Like they have a lot of data on that, and you can use that data once you have your ECFMG ID. So
Okay.
yeah, so make your Excel sheet and then start reaching out to like program coordinators. Do you have an observership program? Do you have a clerkship program? Is it paid? Is it not paid? Like first of all, like look in their website and see if it's there before
Yeah.
like. the program coordinator with questions because again, they like doing something that they can do for you rather than this blind like I want to come like
Yeah. Hi, hello.
yeah, exactly. So like give them a
Yeah.
specific
Yeah.
direction of things and then mark it off on your Excel sheet. This is like dark green because I am getting an observership there. This is light green because I may not get an observership there. This is red. They don't have any observership
Yeah.
spots. So that's how you actually I had three observerships, but I didn't end up doing one.
Oh,
Yeah, I
how
think I should
come?
mention that as well.
How come you didn't end up
But
doing the other one?
my visa, like I was almost like at the end of
Okay.
6 months for the B1, B2. So yeah.
Okay. Do you
Yeah.
think the fact that you already had a lot of clinical experience sort of made up for it in the program director's mind? You know, it was like, okay, she may not have three or four observerships, but she's already worked and she's already sort of seen the field before.
I think that too in radiology is like a double-edged sword. Um,
Okay.
yeah,
Uh-huh.
like some programs prefer having trainees who haven't like finished residency, just
Hmm.
so that everyone's training and not someone knows everything and the rest of the
Okay.
cohort doesn't.
Uh-huh.
Which is
Yeah.
different from what I've seen in like surgery and stuff, where they like surgery kind of like in likes having people who have finished residency in India and then are doing their like second residency here. And the reason why that occurs is because radiology has the ABR program. So you
Okay.
can get to the US if you do radiology residency in India through the fellowship pathway. You don't have to
Yeah.
do the residency pathway. So you can do residency in India, write the steps, and then match here for a fellowship, and then be a full-fledged radiologist if you finish 4 years of radiology training. So that's the reason like programs sort of hesitate. Like if you've already finished residency, like I might
Mm.
as well give that spot to someone who's in the same
Yeah,
stage as everyone else.
that makes
And I feel
sense.
like, yeah, I feel like in the US that's a big thing. It's not all like competitive and like this person is so good and I want them. They
Yeah.
also think if I get this person to the program, is it going to be good to the rest of the people in the cohort? So you all
Hmm.
have to like be in the same, at least the same like level.
Yeah. That's an interesting take on it. I hadn't thought about it like that, where they see sort of how you'll fit into the whole team as opposed to how you are
Yeah.
as an individual per se.
Yes.
Yeah,
Yes. Yes. That's
that
very
makes
true.
sense. And for people who are in their observerships or externships in the US, do you have any pointers as to how they should go about that per se? How they should go about shadowing doctors, even if they don't have as much hands-on experience uh, with that?
Um, like how they have to act in, like how they have to
Or
be in.
yeah,
Oh,
or how they can get the most out of their US
gosh.
clinical experience. Yeah.
Yeah, I would say again, like just be true to yourself and don't always try to talk about the match and like try to establish a genuine connection with this person.
Yeah.
Because at the end of the day, this person might be your program director, or even if you don't end up matching to their program, you might meet them at a conference, you might get a
Yeah.
job offer from them. So, like, try to connect with them as a person and not
Yeah.
as someone you need to impress. Like, I feel like it's very easy to, like, get into this thing of I need to impress this person and talk about these cool things and like looking at it now, I feel like, oh gosh, whenever I did that, I would have been so annoying. Like, because like you see students who are like generally like, oh, hey, what are you doing this weekend? Like, how was your last weekend? Like, how do you feel
Mm.
about this rotation? And students who are like, oh yeah, this is Cartagena syndrome. This is like what?
Mm.
And like people who like constantly like, and I've
Yeah.
also seen students who are like genuinely so smart, like way smarter than me, who like while presenting, they're like, so this paper's in 2024 stated that the risk of this is
Oh,
20% and
wow.
this patient came with this. So I was like wondering. So like, there are students like that who are like genuinely
Mm.
smart. So don't
Yeah.
pretend to be something you're not. Like I'm
Makes
a
sense.
person
Yeah.
who I don't think I'm like crazy smart or anything. Like I'm like a base level of smart, but I think I love talking to people, like forming connections. Not in medicine, because that's not what I want to do, like internal medicine.
Fair
But like
enough.
I like this, like just us talking to each
Yeah.
other, and like just like having a conversation. So like just ask
Yeah.
them how their day is, how their weekend is, whether they drop their kids to school. Like just ask them about like genuine just stuff that makes you happy, and just be true to yourself and honest with yourself.
That's very sweet. And I think that's again something that a lot of people find, you know, quite insightful whenever they're going about anything, regardless of whether it is the US journey or in India. I think that's a good piece of advice. So when you were talking to these program directors or attendings during your interviews, were there any surprising questions that they asked you? Was there anything that sort of threw you off or, pleasantly surprised you during the interview process?
Yeah, I think there was one question. This was what a resident asked me. A resident goes, "What question would you like me to ask you?" I'm like,
Oh, wow.
so I was just like, ah.
I
And I
mean,
think
whatever you want, like.
so yeah, and I think people who like actually prepare for interviews would have known. Like I think that
hmm
might be like a semi-common interview question, but it was like a
hmm
curveball for me. I think I asked him to ask me why my favorite color is pink or something like that.
Oh, okay.
Yeah.
Can I
So
know what your
yeah,
answer was to that?
my answer, my answer is like because pink is like you have like baby pink, which is like so soft, and then you have like magenta that's like strong and like, and then pink overall is just like so feminine, but it can also be
Yeah,
like so many variations of things. Like unlike red, where like red is like is so
a
strong and
lot
like
at once.
yeah, yeah, or like yellow is just like so happy and
Yeah.
like pink can be like anything you want it to be. It's like
Oh,
this whole
yeah.
spectrum of things. So
Spectrum.
yeah.
Oh, that's so sweet. I'm sure they
Yeah.
like that answer.
Yeah, I really hope like people liked my answers.
I'm sure they did that. Actually, that's a very sweet answer to that question. Oh my God.
So
And
yeah, that was like one
yeah.
curveball, but the rest of it was like it was good. Like it's nice talking
Okay.
like interviews and like just talking to
Yeah.
yeah.
And it must have been nice to sort of be done with that whole, like you said, filtering process and actually be able to show them who you are, like through whether it was your violin being up on the wall or just explaining to them how your mind works through your favorite color. Like, I think
Yeah.
that's a very rewarding part of the whole journey, regardless of whether the interview goes well or not.
Yeah, yeah. I feel like
Yeah,
interviewing tells you a lot about yourself.
yeah,
Then
yeah.
just like this, like you were telling me, like how you said being true to yourself. I'm like, oh wait, that's it. Yeah. So it tells you a lot about
Oh,
yourself. It's just like this thing that when babies, like when they're born, like you don't actually teach them like how to talk to people. Like they look at people talking to each other and then they start like learning words. Of course, like you do teach your baby how to like the alphabet and all that, but like
yeah,
they always like look at other people. So like interviewing in that way or just like talking to people, it's like training your brain muscles to be like, how should I be as a social person? Like as a doctor, like how should I be with other people? How should I like listen to their
yeah.
story.
Makes sense.
Yeah.
Yeah, that makes a lot of sense. And I know that the whole process must have been very taxing mentally. It's a very long process to go from, deciding that you want to write step one all the way to the day that you match. Other than music, like you said, was there anything else that sort of kept you sane throughout the whole journey?
Yeah, I think my friends, um, I have a few friends, like, I'm gonna name them, like Suraj and Andrea. I don't know if they'll ever watch this, but like, if they do, like, I used to call them like every 3 days. I remember there was like this some like I made a stupid mistake on my like B1 B2 application where I like put my middle name in one of the forms and didn't put my middle name, and I
Oh.
was like in the middle of the night just crying, and like I call them, and then like another friend, like Alex, um, there was, you remember the Uvalde school shooting happened like during my USMLE's prep, and I was just like, I was so sad. I'm like, am I doing the right decision by going there? And like, just calling my friends.
Yeah.
Like, I called Alex that day and just told him like, I am so scared and so anxious. I don't know if I'm doing the right thing. So yeah, I have friends and talk to them, meet with them, maybe go to concerts. Like, yeah.
Yeah. Be balanced.
Be balanced, yeah. I
Yeah.
feel like I struggle with like balancing. I feel like I'm an all or nothing kind of person, but I don't know, are you that kind of person too?
I don't know. I think it depends. I feel like when I'm really in that headspace, I kind of forget everything else, but to get to that headspace, it takes a lot of takes a lot of
Yeah.
trying.
Yeah.
Yeah.
Yeah, like my parents say that I'm a different person when I have an exam and I'm a totally different person when I don't. And I feel like
Same.
right
Yeah.
now, yeah, exactly. Like right now I'm trying to like bring those two together. I don't want to be the
Oh,
perfectionist, like do everything and then forget about your life. Like I want to like,
yeah.
yeah. Yeah.
Oh, that
Oh
must have
yeah, and
been
the
sweet to have.
Pomodoro.
uh Oh,
Um,
yeah.
yeah.
Lifesaver.
Pomodoro, like, yeah, like it really helped me. I didn't do like
Yeah.
25 minutes, 5 minutes. I did like, I think I did an hour and 15, and like it varied. But,
Yeah.
and I also had this thing where I would get some spice into my studying, but I had like on my like rural service study table, I had these chits with like
Okay.
renal, reproductive, like all put together. And every day I would pick one and then read it, and whatever like came up,
The
I would
stood out.
revise only those questions for like during
Okay.
my clinic. And then I would, whatever I picked up would go to another box, so I wouldn't do the same thing that
Repeat.
week.
Yeah.
Yeah, so it's just like a
Oh,
little
that's
like
interesting.
surprises, like I have some sort of
Yeah.
control over my life, like yeah.
Yeah, that makes sense. It makes it a little less monotonous, I guess, and a little less regimented, which I
Yeah,
think can really
exactly.
mess with your head when you're sort of in,
Yeah,
especially the exam
yeah,
season.
yeah, for sure.
Yeah.
I feel like USMLE is a little more like easier to study than like NEET and stuff, where it's like,
Very
thank God
condensed.
I didn't study for NEET. Oh my God, gosh.
Did you ever consider studying for NEET at
I
all?
gave it. I took the exam.
Oh,
Yeah,
okay.
I don't even remember my rank, but it was really
Oh no,
bad.
it's okay.
Um, but yeah, that was the exam where they asked like what was the unit of visible light in something like
God,
the
no.
answer was like lux or something. I'm like, what the hell is this?
Oh God.
And that's actually something I'm studying now, like in radiology, like we
Oh,
have
oh,
it
in your
in
like
like
intro years, in intro
yeah,
classes.
yeah, like
Fair enough.
radiology physics.
You're like, wait,
I'm
I
like,
know
oh
that.
shit. Yeah.
I didn't get negative marking in that question.
Yeah, so
Oh
yeah, like
God.
the questions on NEET are like, oh yeah, what's the size of the femur? Like 20 centimeters from the tibial plateau. Just
God.
yeah, it's
God.
insane. It's insane. NEET is insane. Like props to whoever's studying for NEET.
Right.
People
No,
say
for
that
sure.
yeah, it's definitely a harder exam to MLE in terms of how much you have to remember. I feel like
Yeah.
MLE is more of an analytical exam than a memory exam. Yeah, you have to remember some stuff, but it's more like what's your next best step, what diagnostic test would you use, like stuff like that. Whereas NEET is like, this is this, what's this?
Yeah, that's true.
And like they're trying to make it more clinical, but it's like when I went to the exam, I'm like, this is so pretentious because like
Oh
like they have this whole clinical story, okay? Like it's like,
no.
oh yeah, like this person has this surgery, they came in with the symptoms, this, and then the last question is, which position would this surgery be in? And I'm just like,
God.
oh.
Oh
Yeah,
no. Oh
yeah.
God. No, that's interesting. Did you just kind of freeball the exam? You just kind of went in to see
Yeah.
how it would. go?
Yeah, actually, my mom told me to write the exam, and
Oh,
I
okay.
still to this day I'm like, if I hadn't written that exam, I would have been so much better as a person in my life. Like, obviously, just to, like taunt my mom a little bit, but like this exam, I took it like 2 months before I got that 257 on NBME 14. So the result
Oh,
came, yeah, the result of NEET came, and then I gave NVME 14. So I was like really feeling bad about my NEET result being bad. And then I got 257 and NVME 14. I was like,
you were like, this is, pack it up, you guys. Like, not happening.
yeah, I'm like, this is the end of my life. Like, I don't know what I'm doing. I'm gonna go back to my rural service center
Oh,
and just like, yeah. So it was not.
oh.
Props to whoever writes NEET.
I agree. No, for sure. I have people in my class now who are preparing for the exam, and I'm like, you have to remember those facts. You're writing the exam in 3 years. I don't know how. To
I
understand
don't
and to
know.
remember are two very different things, I feel. Oh
Like I
God.
would be the person who says like treatment of hairy cell is like weed. I saw that recently. It was so funny. I laughed for like 1 hour.
Oh
Yeah.
God. Yeah. Then I guess it's good that you had the other option and
Yeah.
one like wasn't forced to do. I hope it does
Yeah.
change with next though now. I hope that something does, some good does happen. Does some good
Yeah.
change does happen to the sort of education system here.
Yeah, for sure.
Yeah.
But I also feel like Indian doctors, they're so smart that if you make it like
Yeah.
USMLE, like they'll take like 3 or 4 years to like get used to the exam
Get
pattern,
used
and
to
then
the exactly, yeah.
so then you have
Yeah.
to like throw in these curveball, what is the unit of light and everything so that you have some
Just
sort of
just a rejog there.
yeah. Yeah,
Yeah,
exactly.
sometimes I see like these like the smartest clinicians who in India who truly like they have some of the craziest analytical skills. And then I think to the fact that like the books that they're studying and the way that I'm like, you're doing both. You're practically you could write Emily, but you could also ace need. Like
Yeah, yeah.
I
It is,
it's really insane.
yeah, it is insane. Like people are so smart in India, it's
Yeah,
insane.
no, I agree for sure. It's just another type of smart. It's another league altogether.
Yeah, yeah, for real,
Yeah,
for real.
yeah. So, coming back to your match process, and more importantly, the day that you matched, where were you when you matched? What were you doing? What were the emotions?
On match, this is match day and not like where you find out where you are.
Yeah, yeah.
Match day, I was at home and just like we just said like a prayer, and then after the prayer, I like opened my match result, and then I figured out that I was matching. It was very sweet.
Oh.
I feel like my parents like once once the thing happens, they're like, yeah, we kind of knew it would happen. Like, what else is gonna happen?
Yeah, of course. Like it was said from day one.
Yeah, like
Oh,
the same thing happened when I got in like St. John's as well. Like,
oh,
my dad called me and he's like, "Yeah, I kind of knew that you would get it," and I'm just like, "But there was so much that went behind this." And yeah, my parents had supported me a lot. Like all my
yeah.
tantrums, I used to like put on them. So yeah, we
Oh,
just said a small prayer. I was at home and I opened the match result, and yeah, nobody was like, "Ah!" It was
it was like,
everyone
yeah.
was
See,
quite
I told you so.
yeah,
Like,
yeah, exactly. It was more like that. Yeah.
oh, that's also sweet in a way. It's like they always believed in you. They always sort of knew.
Yeah,
What about the
exactly.
day that you found out like where you matched?
That day I actually threw a match party because like I knew I had
Cute.
matched. Yeah, so
Yeah.
I like, and it's so weird because like obviously nobody celebrates match day in India, and like my friends' parents were like, "Are you getting engaged? Did you match with someone on
There's
Tinder?"
something
Like.
else? Like, what is it? Yeah.
And like there's like this whole like I actually like a friend of mine got me stuff from the US for match day, like these
Aw.
like banners and like the cake
Aw.
covers and everything. So it was really fun. And we all I had a shirt that said like I matched here at like yeah.
Aw. Oh,
So
that's so
like
cute.
yeah, I threw a match day party because like at that point you matched. It's just like where am I going? And
Where are you
um,
going? Yeah.
yeah, so I was like,
Oh,
why not? Well, let's just party.
yeah, no, for sure, for sure. Oh, that's
Yeah.
so cute. Yeah. And do you have any plans after radiology? Do you know what you want to specialize in? Do you know what pathway you want to take after, you finish your
Yeah.
residency?
Yeah, I do want to do, I'm thinking of doing two fellowships, but now this is gonna
Oh,
be
cool.
like up in the air
Okay.
on the wide web, and I'll see you 5 years from now. I'm like, shit, why did I say that?
Oh,
But yeah, I'm thinking of doing MSK, musculoskeletal, or breast.
cool.
I'm also
Hmm.
considering doing IR, but I'm not completely sure as of now. But I know for sure that I want to do a lot of AI and LLM stuff.
Oh,
I'm
cool.
already
Yeah.
working, but then it like becomes something that's integrated into Epic. Yeah,
Yeah.
so yeah, I see myself like being in a clinic, but also spending a lot of time in AI companies, seeing how we can make better medicine better for our patients.
Oh, no, that's super cool. That's super cool. And how did you decide to start your Instagram page, the Resident RX? I know that I haven't mentioned that until now, but so
Uh,
how did you get the idea of starting the Resident RX?
a lot of people told me that I need to start like a YouTube channel. But
Oh,
like I'm just like super scared. Like, what if people tell me like, in fact, like even when I made like the Resident RX, a lot of people like messaged me saying, "Oh yeah, you just matched because of connections. You're supposed to be honest with that." I'm
uh-huh.
like, you don't even know me, dude.
Exactly.
Yeah. So
No, no,
like
they
I was
know.
really scared of that. I was
Yeah.
really scared
Oh,
of that.
okay. Oh, yeah.
So I didn't start it for the longest time. But then when I got to like internio, there are like phases of internio, especially like when you're living away from family and you can't
Okay.
communicate with like, especially in Minneapolis, there are not a lot of Indians, so it's like
Okay.
you don't really see a lot of like Indians. You don't really hang out with Indians, but
Hmm.
almost like every single day someone either from my med school or someone else who like my friends are familiar with would like message me and ask me for advice. So I'm like, why don't I just make a channel about this?
Uh,
And I just
yeah,
posted those two. I don't know if you've seen them. It's like the first video is
probably
like
have.
the first video was like the how I report scans as a radiologist in Bangalore, and the
Yeah.
other one was just like my story. And I remember I woke up and my phone's like blowing up, like I'm getting like so
Oh.
many followers, people are messaging me.
Oh.
So yeah, so like
Yeah.
then I was like maybe I'll try doing this in the long run. I mean it's still a work in
Yeah,
process.
of
I
course.
still it's a very small channel right now, but yeah, I'm not. I don't think I'm gonna be one of those like 120,000 like
Hmm.
followers. Like, this is
Yeah.
my part-time job kind of situation, but again, like the reason I started it was to have some sense of community and
Yeah.
help other people. So yeah, and this is like what's happening. So yeah, I
Yeah.
hope
No, that's
that
so
continues
sweet.
to happen.
Yeah. Yeah. No, I think I can speak on behalf of a lot of your followers that it has helped, especially for people that, want to match into more competitive specialties as a non-US IMG. It's so cool to see people who actually do it because the moment you say that I want to match into XYZ, and it's not, like you said, IM, FM, PEDS, or psych, the first thing they kind of tell you is, oh, good luck. Oh, like it's sort of
Dude,
like
yeah.
you're not gonna do it, but it's
Yeah.
okay. It'll be cute to see you try.
Yeah.
So I think it's really inspirational to see people actually, break this stereotype and go out and do what they want to do.
For sure. Like when I
Yeah.
told people that I'm applying radiology, a lot of them were like, you're applying for something else too, right? I'm like,
Yeah. Like that's a backup option, right? Like
yeah.
oh,
Yeah.
oh, yeah, no, but it's unfortunate, but I guess it's
Yeah.
why we need people like you to sort of share their story and make it seem more possible, you know.
Thank you.
Yeah, so you'd mentioned about how where you stay there aren't many Indians. Um, were there any culture shocks when you did move to Minnesota? Was there any?
Yeah, I feel like Minneapolis, I would say, is a little different from at least most major cities. In the US, I feel like it took a while to recover from like COVID and the movement
Yeah,
that happened. BLM started in Minneapolis.
yeah,
Um, and I feel like everyone's still sort of recovering from that, and the city took a major hit. Um,
yeah.
and so it's still like in that phase where what happened at that point was people who lived in the city moved out of the city, and everyone was working from home. So, like, after that, the city, I feel, at least what I'm seeing, is still working on getting those people back to the city. So, unless there's like a concert or like a festival going on, there's not a lot of people like walking around. So, I think
Okay.
that was the biggest culture shock for me, especially like living in Bangalore, where if you just look out, you'll see at least 100 people. And like coming
Yeah,
here, like I live in the middle of downtown, like US Bank Stadium where Taylor Swift performed a year ago is like
right
three
there.
minutes walk. Yeah, like if I look outside, I can see it, and it's
Oh
still
wow.
empty.
Oh
So
yeah.
it's like it was just like a culture shock to me that why aren't there
Mm,
people here? But yeah, I feel like the city's slowly coming back to what it was. I didn't see it before like COVID and stuff. So I don't know what it was then, but like people say it's definitely different. It's like they say it's like a ghost town right now, but
oh,
yeah,
okay.
I think it's improving a lot. Like last week we had the weekend concert and there were so many people here.
Oh, nice.
Yeah, so
Okay.
whenever there's like concerts or like a Vikings game or like a Twins is our baseball team, Vikings is our NFL team, and then we
NFL
have
team.
the
Yeah.
Timberwolves. Yeah, the Timberwolves who are our NBA team. So whenever they play, it's like the city is like bustling. It's
On fire.
amazing.
Yeah.
Yeah,
Oh.
but like when they're not there, it's like it suddenly gets empty because yeah, everyone's like moved out of the city and they only come back to the city for like you know events and stuff. So yeah, it's fun, but it did take a little getting used to when I first
Hmm.
got here.
Okay. That makes sense. And what role do you think sort of putting certain locations with certain priorities on your application, what role do you think that plays in terms of matching, especially with radiology in particular? Do you think putting certain places above others helps you, or is it more of a luck game?
I think it does. At least in my scenario, I had good reason to put things as my priority, but
Yeah.
also it's not a be all end all. Like I did not put Minnesota as my top like two. I think I only put
Mm,
two. I didn't put three.
okay.
I did put it in one of my top two locations because like it just took me a while to get used to it, and I don't have any family or like anyone I did not have anyone I knew here before. Like now I have my friend group and everything, but I knew that if I come to Minnesota I'd have to start from scratch. But I ended up
Yeah.
matching here, and it was actually my first choice on at the end in my rank list because
Oh, nice.
they offered me the H1B, so I'm like
Dude, take me.
yeah, take me, yeah. Take all my money, take everything. Yeah, so yeah. Yeah,
Uh,
so it wasn't a hard choice to put Minnesota first. It's just that I hadn't put Minnesota in my like places to go to or my preferential
okay.
places, but I ended up ranking it first. Yeah,
That's again, all's well that ends well, I guess.
yeah,
Not always the most direct answer that you think is the best. So I
yeah.
think that's also a cool point for people to think about. And just to wrap up the whole episode, what's the best piece of advice that you received throughout your entire journey?
Um, I remember talking to Suryansh Bajaj, who's now a PGY 3 in University of Arkansas, and he was another person who had matched without doing a formal research. And I remember when everybody was telling me, you can't match radiology, it's impossible, you can't do it, you need a backup. Like, and these are not people who are like people who don't know the journey. There was a professor from Harvard who told me that I'm wasting my time.
Oh, wow.
And that really hits you, yeah.
Yeah.
But then I spoke to Suryansh. I remember I was in my rural center, and I'm like, "Do you really think this is really hard and I can't do it?" And he was like, "No, I don't think it's hard, and I think you can do it." And I feel like that really changed my whole journey after that. Um,
Yeah.
yeah, and yeah, I really am so grateful to so many people who like told me these little things, like gave me these little connections. But yeah, I would say that was a piece of advice that changed my trajectory, and I was like, okay, if Suryansh can do it, then I'm gonna try to do it.
Yeah.
Yeah.
Yeah. It's a matter of having, people who actually believe in you and not just
Yeah,
sort of put you in a box, your journey in a box before it's even
yeah,
started.
yeah,
Yeah.
literally.
Yeah. So again, thank you so much for coming and joining us on this episode. I'm sure everybody listening has taken home a lot of very insightful points from your journey, and I'm sure you've inspired a lot of budding radiologists who may want to go to the US as well. So
I really
thank you
hope
so
so.
much for
I mean,
coming on. Oh, for sure, yeah.
yeah, thank you. Yeah, that was the aim of me starting my channel. So yeah, I really hope that someone out there thinks, okay, I can do it, and tries their best.
For sure. Thank you so much again, and thank you to everybody listening. We'll catch you in the next one.